Greetings, friends! If you experience foggy vision, see floaters before your eyes, hear ringing or buzzing in your ears, have trouble concentrating, notice your memory getting worse, wake up in the morning already feeling tired, even though you seem to have slept enough, or if your sleep is disturbed, if you sleep restlessly, or have trouble falling asleep, then please watch this video until the end. Today, I will show you a very simple but extremely effective exercise. It powerfully boosts blood flow to the brain, restores venous outflow, and most importantly, after doing this exercise, you won't need any more pills for brain circulation. All of these conditions I mentioned have one thing in common. They are caused by inadequate blood supply to the brain. It doesn't get enough nutrients, doesn't get enough oxygen, and venous outflow is disrupted. All of this leads to a huge number of symptoms. Heaviness in the head, ringing, floaters before the eyes, and impaired cognitive functions. And first and foremost, we need to pay attention to our cervical spine. So please take a look. Here I've drawn the 7 cervical vertebrae. This is the skull, view from the side, meaning the person is looking sideways. I've marked a vertebral vein in blue and the vertebral artery in red. Accordingly, these blood vessels provide adequate blood flow to the spinal cord, medulla oblongata, cerebellum, occipital lobes, and also ensure proper venous outflow. These blood vessels pass through the transverse processes of 6 cervical vertebrae. There, we have the vertebral canal. In the 7th vertebra, they do not pass through because there is no such opening. So friends, on the sides of the cervical region, that is, on the right and left, we have the scalene muscles, anterior, middle, and posterior. If the scalene muscles shorten, if trigger points form in them, first of all, this kind of compression occurs. That is, the vertebrae start to compress, which increases the pressure on the intervertebral discs and intervertebral joints, leading to hernias, spondyloarthrosis, and the formation of bone spurs, also known as osteophytes. They can already start to affect the blood vessels. Plus, most of the time during the day, we sit kind of turned to one side, so our scalene muscles shorten unevenly, and when that happens, the cervical spine itself starts to deform slightly, tilting to one side or the other. This leads to a change in the lumen of the vertebral artery, and as a result, the blood vessels in the cervical region are the first to suffer. That's why our main goal is to restore the scalene muscles on both sides, so that the neck returns to the correct, healthy, neutral position, and the blood supply to the brain is adequate. In order to perform a high-quality, effective self-massage, eliminate all trigger points in the scalene muscles, and stretch them well, we first need to locate these muscles. When we understand the anatomy of the muscles, we can do exercises and work on them much more effectively. So how do we find them? Turn your head slightly to the side, tilt it forward, and you'll see a muscle start to outline itself on the front side of your neck. This muscle is called the sternocleidomastoid. Right away, I can grab it with my fingers, and just behind it, deeper in, where I place my fingers, that's the anterior scalene muscle. Friends, this muscle runs from the first rib up to the lower jaw, meaning it attaches to the transverse processes of the cervical vertebrae and goes deep under the clavicle. See, my fingers are right on it. To find the middle scalene muscle, we move about a centimeter to the side. You can actually press and gently move your fingers back and forth, and you'll feel the muscle rolling under your fingers. So, from the lower jaw down under the clavicle, also attaching to the first rib, that's where this muscle connects. We need to work on it along its entire length as well. And to find the posterior scalene muscle, we pinch the horizontal part of the trapezius with our fingers. A lot of people massage this area themselves or for their loved ones, so most people usually know where this muscle is located. So once you've grabbed this bundle of muscle, right in front of it, where my thumb is now, this is the area where the posterior scalene muscle is located. I can actually place 4 fingers in this area. That's it, I'm right on the posterior scalene muscle. It's shorter, so we don't need to move upward. You only need to work with this point. The posterior scalene muscle goes deep in there and attaches to the second rib. So this area is quite sensitive. After all, it's the cervical region, so we can only work with the pads of our fingers. Some people are a bit afraid to work on their own necks. Let me say right away, the sternocleidomastoid muscle here acts as a boundary. In front, we have the neurovascular bundle, the jugular vein, the vagus nerve, and also the carotid artery. The thyroid gland is also located here in the front. That's why we don't work on this area. That is, the area in front of the sternocleidomastoid muscle. but behind it is a completely safe zone. Here you can safely perform self-massage. Friends, use your fingers to grab the sternocleidomastoid muscle. If you can't do this, turn your head to the side and tilt it slightly forward so the muscle becomes more prominent. So I grabbed it, shifted it a bit toward the center, placed my fingers on the anterior scalene muscle, pressed it against the cervical spine, and moved my hand as far down as possible. Basically as far as my hand can go, trying to get right under the collarbone. With my other hand, I apply pressure to the fingernails. So this is the position of the hand. This way, it'll be much easier for you to do self-massage. So we grab the muscle, position it, and now what do? We make scooping movements from the outside in. You'll feel the muscle rolling under your fingers. You need to make these pulling movements towards yourself with pain and discomfort. Right on the edge of it hurts, but still bearable. We're mechanically breaking up trigger points, kneading them. You absolutely shouldn't go easy on the muscles. Gradually, we move higher and work through this entire area. Friends, when you do self-massage of the scalene muscles, which are tense in many people, you might feel referred symptoms spreading in different directions, into your shoulder, your chest, back between your shoulder blades. For some people, it radiates to the jaw or even the head. This muscle gets very tense and is often prone to referred symptoms. If you do have these symptoms, it means the tension has been there for a long time, and ideally, of course, you should have started working on it a year, 2, or even 3 years ago. So we work on the anterior scalene muscle for 2 minutes. Then we move about 1 centimeter to the side, and I reach the middle scalene muscle. We perform the same movements. I place my fingers and make movements from back to front, working across the muscle fibers, gradually moving higher. You can even set a timer for 2 minutes and work on each scalene muscle. This is our middle scalene muscle. Overall, this kind of self-massage is quite simple and can easily be done at home. So now let's move on to the posterior scalene muscle. We shift back by 1 centimeter, and here's the second landmark, the horizontal part of the trapezius in front of it. I place my fingers here, apply pressure, and make the same back to front movement, just like before, for 2 minutes, friends. So in total, that's 6 minutes on one side and 6 minutes on the other. It would be great if you could massage your scalene muscles on a daily basis. For example, in the evenings, so you don't strain your neck and can go to bed afterwards. So that's a total of 12 minutes. If you can't do this every day, then at least every other day. Or at the very least, try to do this self-massage twice a week. If you can manage to do it every day, that's perfect. Every other day is still pretty good. And that's all for now, friends. Please take care of yourselves and your loved ones. If you'd like to support me, please subscribe to this channel. That's the best support and the best motivation. That way, I know you enjoy my videos, you're getting something useful, and please stay healthy. See you in the next episode.